This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2025. Robot-assisted spine surgery, or RASS, enables the precise placement of pedicle screws along pre-planned trajectories, helping surgeons perform complex spinal procedures with accuracy. Despite its advancement in patient safety, previously published studies have still identified continued instances of complications with RASS. In this study, researchers evaluated whether standardized institutional protocols for RASS could reduce complication rates. They analyzed thoracic and lumbar RASS procedures performed on 554 patients at a single hospital. 264 surgeries had been performed before a RASS best practices protocol was enforced, and 290 surgeries had been performed after implementation of the protocol. The main pillars of the institutional guidelines involved reviewing their institutional performance and understanding the sources of error, assigning all RASS stakeholders, spine surgeons, assistants, OR staff, neuromonitoring and radiology technicians, and robot specialists, responsibilities to verify robotic accuracy, RASS surgeons agreeing on mandatory safety checkpoints before proceeding with each stage of surgery, and guidelines focused on robotic technique, reference frame placement, communication across the OR, and modalities to confirm accuracy. The protocol was enforced and upheld by the surgeons and the robotic specialists throughout this study. The data showed that 2.3% of pre-protocol surgeries had robot-related complications, including wrongly positioned screws, durotomy, and injuries to sensory or motor nerves requiring reoperations. Half of these complications were due to reference frame errors, causing pedicle wall breaches. After implementation of mandatory best practices safety protocols, there were 0% complications up to 2 years. The post-protocol group showed improvements in post-operative screw accuracy with no clinical revision surgeries to address pedicle breaches. Non-robot-related complications decreased numerically from 26.1% to 19.7%, although this difference was not statistically significant. Several perioperative outcomes also improved after protocol implementation, including reduced blood loss and shorter hospital stays. In summary, standardized institutional guidelines and safety checks play a critical role in preventing complications in RASS. Well-designed, institution-specific protocols can significantly improve outcomes and are recommended for all spine institutions using robot-assisted spine surgery systems.